Hello, my name is Cassandra Munoz, and today I will be going over the importance of diet, exercise, and safety measures with Parkinson's patients. First, I will start off with the diet. This often reflects what 5 stages the patient has progressed. If they can eat with only one side being affected, do they need to have specialized utensils to eat? And if more progressive, past stage 4, which are the more severe tremors, then a nurse should be present to assist in their feeding. According to the Michael J. Fox Foundation for Parkinson's, the nutrition itself should be well balanced, consisting of fruits, vegetables, and grains. Foods that Parkinson patients should absolutely be avoiding is anything with tyramine, and that is about aged cheese, beer tap, and cured meats, and this should be avoided in order to prevent any worsening in their conditions. Patients should be drinking more fluids, and this is to help prevent with constipation, and that's the diet portion. Next up, I'm going to be discussing the exercise. Now, with exercise, always try to maintain autonomy as much as possible for the patient by first providing them with a walker. Music can be added as a beneficial factor for the patient, and this will help them figure out their rhythm and own pace as they walk on by. Exercise does help these patients control better coordination and muscle balance. Now, with the next portion up is exercise, and we always try to maintain patient autonomy, and so we usually provide a walker for these patients, and music can be added as a beneficial factor for the patient as they can pace with the rhythm of the music. Exercise does help these patients have better control over balance and coordination, and rather than just having them decline entirely, because if they do not exercise, eventually over time it will decline, and that's something we want to prevent. So make sure that the patient has the necessary tools for physical therapy, and that can be simple as getting them dressed up and emptying out their bladder and elimination beforehand, as well as providing the medications so that way the patient may tolerate these types of exercises. I do not have a walker, however, I do have this to act as the walker. So what you want to instruct the patient to do during these exercises is you want to make sure they get up slowly, help them maintain a balance with the gait belt, and afterwards, if they would like any type of music to help them with, you can already set that up. And you want to make sure they have a good handle on it, and that their feet are kind of evenly spread apart towards the shoulders, and make sure you're also right behind them in case anything can happen, and they should be able to kind of like just start walking on their own. It should be looking something like this, and just make sure that they go at their own pace. So lastly, with safety measures, with that being said, we as nurses, we have to make sure that the patient's room is free of cluster, obstruction free, and this means kind of like no throw rugs that can be easily, can have the patient slip and fall. And we also want to make sure that if they are going home, that we provide them an alarm in case that does happen to them. A handrail should be installed throughout the restrooms in the household and also inside the facilities. Providing good lighting is also to help them in preventing them from falling. And last but not least, that they have an excellent source of a support system. All of these teachings can help our patients with Parkinson's disease. And that's about it. And thank you so much for watching. My name is Cassandra Munoz, and that covers the diet, exercise, and safety measures for Parkinson's patients.